Hi everyone. I can see people sort of gradually floating in. I'm always very keen on starting on time for rewarding the people who are attending. My name's Molly Gallia and I'm from the Collaborative Centre for Mental Health and Wellbeing. Hello to those of you I haven't met before. And we're very excited to welcome you to the second of the series in the digital health for mental health, which is an area that many of us don't know very much about, or can feel like it's kind of moving along too fast to keep up with. So I'll introduce our speaker for today in a minute, but first I would like to acknowledge that we're meeting on the, or I am meeting you all on the lands of the Wurundjeri Woiwurrung people and pay my respects to elders past and present. And if you would like to pop the land that you're joining us from in the chat, that's always very interesting to see where we have people joining from. I also want to start us with a bit of a poll, which hopefully you should see now. I'm going to do a poll at the start and a poll at the end. So I'm trying to get a bit of an understanding on where we are at the moment in public mental health services in Victoria. So I'm going to start off the session by asking a bit about what people see as your barriers currently, and I'll end the session with finding out a bit about what you'd like to learn more about. So if you've got things that I haven't listed there, please pop it in the chat, because I'm sure I won't be able to think of everything, but it's good to have a bit of an understanding of what's going on, where we're at currently. So while people are catching up with the poll, I'm going to introduce Dr. Lou Farrer, who I'm very privileged to have met during setting these up. And Lou is an associate professor at the Centre for Mental Health Research at the Australian National University, and is a nationally recognised expert in digital mental health. And I haven't written it here, but I think your background was psychology. Is that correct, Lou?
Yes, that's right.
And her research explores how technology can be used to improve mental health care, including the design, evaluation and implementation of online interventions, with a particular interest in supporting young people and university students. And I thought this was such an important session to include because there's so much out there. There's so many different apps, health, wellness, how to help people apps. And I think as mental health professionals and practitioners, our recommendations have so much weight for people that it's really important that we need to be able to trust what we're offering, but it's also really important to acknowledge that people are taking what we're recommending quite seriously. So I'm very excited to be learning more about how we can assess and understand which digital tools are useful. Okay, I will end that poll. Thank you to those. Let me see if I can show you the results, and then I will hand over to Lou. So we have uncertainty about which to trust is the biggest of the group that have voted so far,
Right.
and ethics and privacy concerns, and then things about confidence and lack of support. So thank you very much for sharing that, people. And Lou, I'll hand over to you.
Absolutely wonderful. Hello, everybody, and welcome. I'm so excited and thrilled to talk to you today about this topic. And it's wonderful to see that you're all interested in, or a lot of you are interested in uncertainty about tools and what to trust. So we're going to talk about a lot of information today. But before I get into that, I'm based in Canberra, so I just wanted to acknowledge that I'm joining you today from the lands of the Ngunnawal and the Ngambri people. And I'd like to thank them for their ongoing custodianship of this beautiful land that I live and work on, and pay my respect to their elders past and present. Let me just make sure I can move my slides. There we go. Okay. So Molly already introduced me, but I'm an academic researcher based in Canberra at the ANU. I've worked my entire career in digital mental health. That's my specialisation. But I'm coming today to today's webinar from two angles because I also am a clinician. So I'm a registered psychologist as well, and so I work clinically with people, and I use digital mental health tools in my practice as well. But my predominant role at the university is in research, and specifically within digital mental health research. And I love this topic and I love this field because it's something that I've worked in for a very long time, and some of the earliest digital mental health programs based on CBT that were developed, going back 25 years now, were actually developed here at the ANU. And I've just put Mood Gym and eCouch. These were some of the earliest, they're quite ancient now, some of the earliest digital mental health programs, self-help digital mental health programs that were developed and evaluated. And so yeah, this is an area that I'm really thrilled to talk to you about today. So what are we going to cover today in this webinar? I've tried to balance coverage, so we're going to cover a lot of different things, but I'll also like to provide you with some really sort of detailed information about evidence and about how to use digital tools in your practice. And so we're going to cover a range of different types of topics. We're going to cover what I mean when I'm talking about digital tools. We're going to talk a lot about what the research says. So what does the research currently say about the evidence base for different types of digital or e-mental health programs? We're going to look at some models or different ways that you can use digital tools in your practice. And so there's a really wonderful paper that was written by a colleague of mine about different models of e-mental health practice. We're going to talk a little bit about how do you judge the quality of a digital tool? How do you judge its trustworthiness or whether it's any good? What sorts of things should you be considering when you're judging the wide range of digital tools that are out there and available at the moment? And how might you go about selecting a particular digital tool maybe to use with your clients or a particular client that you might be working with? So this is all of the information that we're going to cover today in one short hour. So apologies if I'm going very quickly, but we'll do our best. So what do I mean by digital tools when I'm talking about digital tools? I love this diagram. It's a little bit old now because you'll see there that I've added another little section that's talking about AI, chatbots and digital companions. As Olivia sort of raised last week, that's obviously something that's really emerging currently in the digital health space. But as you can see there on that lovely colourful wheel, there's a range of different digital tools and e-mental health products that are out there, or programs that are out there. So it's not a one-size-fits-all type field. And so we will go through each of these different types of things in turn. I'll talk about what they are, and I'll talk a little bit about what the evidence is for these sorts of things as well. Just a quick note about evidence before we talk about what these digital tools are and what the research says about them. I've included that little the evidence pyramid. You might be familiar with this sort of thing. You might have come across it before. But when we're talking about evidence, you know, as clinicians, we follow a scientist practitioner model, and that's a really foundational and important part of our practice because we need to ensure that the work that we're doing with our clients and the clinical services that we're delivering are grounded in evidence. We need to know that they work. And so how do we know that something works? We need to follow rigorous scientific practice and scientific methods to judge or evaluate the effectiveness of particular treatment approaches. And that's no different for digital tools. And so based on this evidence pyramid or research pyramid that you're talking about here, what this says is that there are research designs that are more trustworthy or more reliable or more robust than others. So a lot of the evidence I'm going to talk about today comes from randomized controlled trials or systematic reviews of randomized controlled trials. And so it's just saying that there are different types of research designs or evidence that we can find when we're looking for the effectiveness of judging the effectiveness of different digital tools. And there are some that are more trustworthy or more scientifically robust than others. So it's important to note that digital health is a really dynamic and rapidly changing field. And we also know that research and evaluation, or good research and evaluation, takes both time and resources. It takes money as well. And so what can happen is that lots of digital tools are constantly being developed and pushed out to the market. So they're available for people, but the research field is there's a long lag, there's a long time that it takes to be able to actually subject these particular digital tools to rigorous scientific evaluation. And so for some or a lot of these tools, they may never have been evaluated because it takes time for all these barriers that I've talked about before. So some digital tools that are available, particularly internet-based online programs or digital CBT programs, have a lot of evidence to support their effectiveness. And that's because they've been around longer, so they've had longer amount of time to be able to have lots of research trials be conducted on them. And some of these newer, more emerging tools may have been around less time, and so they had less opportunity to be evaluated scientifically. Again, like I said before, most of the evidence I'll talk about today is from systematic reviews and randomized controlled trials. And at the end of these slides, I've included all of the references that I have referred to or that I've gotten my content from for today. So if you're interested in the evidence for any particular approach that I talk about, I've got the references there so you can go and find where that evidence is coming from. Levels of evidence are really important. So like I said, we need to trust the results of randomized controlled trials in particular. But it's also important to understand that emerging evidence is still important. And so say if a randomized controlled trial hasn't been conducted yet on a particular digital approach, we need to be cautious about the effectiveness of that approach, but emerging evidence is still important. Our clinical expertise is important as well. Sometimes in randomized controlled trials, because they're conducted in very, very tightly controlled situations and settings, they may exclude people that have any kind of clinical complexity or comorbidities or things like that. But we know working clinically that our clients come from wide variety of backgrounds and have a wide variety of different types of comorbidities and complexities in their presentations. And so when we're applying the evidence that is generated from a randomized controlled trial, we need to think about generalizability as well, and about, does the evidence from this tightly controlled research trial, does that translate well to the sorts of clients that I work with? And so we need to sort of think about and consider those things as well. And just finally, this is a pretty obvious kind of point, but I just wanted to say that evidence of ineffectiveness is not the same as lack of evidence. And so if a digital tool has had lots of research conducted on it and it's been found to be ineffective, so it doesn't work, that's not the same as another digital tool that we don't know if it works yet. It just hasn't been subject to the same level of research scrutiny or evaluation as, say, something else. And so these two things sometimes can get confused, but these two things are actually very, very separate as well. Okay, so let's launch straight in, and we're going to start on our digital mental health wheel. We're going to go around the wheel, and we're going to start with online programs and apps. This is probably, apps are obviously a newer, more emerging kind of technology, but online digital CBT programs have been around nearly 25 years. Some of the earliest programs were developed in the early 2000s. And we can kind of consider them, you'd be very familiar with these programs, but they're sort of like an online or digital or modern version of self-help. We had self-help books previously, and online programs are really just modularized versions of that, and they're usually based on structured therapeutic principles and strategies. A lot of them are based on CBT. They contain psychoeducation and exercises, so they're sort of like taking the principles of a structured therapy approach, putting them into modules that you can complete online. My Compass and Mood Gym are just two Australian-based ones that have been developed, and I put some apps on there as well. These sorts of online programs, they can be guided or self-guided, and so self-guided programs are those that are completed just by somebody by themselves. And so if you just wanted to go on and create an account and complete one of these programs completely on your own, that would be self-guided. A guided program is where there is somebody who helps you use this program. So it might be a clinician, or it might be a peer coach, or it might be somebody who checks in with you regularly and says, how are you going with your online program? Do you have any questions? Is there anything I can help you with? So that would be a guided version of an online program. And these online programs and apps, they can vary a lot in their length. So how many modules they are, how complex they are, how much text they use, whether they use other features like videos, lots of images. They vary a lot in terms of how they're delivered, but they usually contain the same sorts of strategies and psychoeducation and sorts of approaches as well. So what does the evidence say for these online programs? Online programs probably have the largest evidence base, particularly those that are based on CBT, of any digital mental health program that's available. And that's because they've been around for a reasonably long time. So there's less evidence available for smartphone apps, again, because they haven't been around as long, but they have been evaluated as well. There is very clear and robust evidence for the effectiveness of online, particularly CBT programs, for a wide range of mental health conditions. I'm not going to list them all because they've been evaluated across depression, anxiety, eating disorders, substance use disorders, PTSD, a whole range of different types of things. And so there is very, very strong evidence for the effectiveness of these programs. So they're reasonably trustworthy. Guided programs, so programs that are delivered with the support of a human being as well. There is pretty consistent evidence now to show that they're associated with greater efficacy. They're more effective than the programs that are just delivered as a standalone, self-guided way. And people usually stick to them a bit better if they have guidance compared to those if they're completing them by themselves. And it's not to say that self-administered programs aren't effective, but adding a human element to it seems to boost the effectiveness of these programs a little bit more. Interestingly, there's pretty robust evidence now to show that you're getting similar outcomes in terms of symptom reduction and effect sizes compared to face-to-face therapy with these online programs. And so that's a really interesting thing as well to consider. There's evidence now for online programs that deliver a range of different types of therapeutic modalities. There's the most evidence, as I said, for CBT-based programs, but there's now programs out there that deliver IPT, ACT, DBT, lots of different types of therapeutic approaches as well. Most are conducted with adults, but there is certainly evidence to show that they're effective for children and adolescents as well. And we also know from the research that higher engagement, so the more modules that you complete of an online program, it's going to be associated with slightly better outcomes as well. So let's move on to virtual reality. What's virtual reality? That's our next on our little e-mental health wheel. So it's about the ability to create immersive environments without leaving the clinical setting. So it's about putting people into a VR space that creates a realistic but digital environment. And it has a lot of clinical applications in terms of both assessment and treatment. And so VR environments can be used for assessment purposes, so they can be used to, I've used air quotes because it sounds, I don't really like the sound of it, but it can be used to trigger symptoms, to assess whether people, for example, in psychosis, whether there's the presence of paranoia or hallucinations or delusions. They can also be used for exposure, and that's probably the most common application of VR in clinical settings, is used for exposure. So, you know, people with specific phobias, such as phobias of spiders or heights or things like that, VR can be used successfully to treat those sorts of conditions. It can also be used to create states to, you know, in which to practice mindfulness and stress reduction as well. And so, what does the evidence say for virtual reality? It's most commonly evaluated, as I said before, in anxiety disorders, but it has been evaluated for PTSD, and psychosis, schizophrenia, as well as eating disorders and substance use disorders. There's the most convincing evidence currently for VR exposure for the treatment of anxiety disorders, specifically specific phobia, as I said before. There's less available evidence for the effectiveness of VR for reducing depression symptoms and for assisting with OCD. Most VR studies currently are conducted in adult samples, so our evidence is a little bit less certain in other sorts of age groups as well. Moving on now to online peer support. So online peer support is another digital approach, and this is where people with lived experience of a mental health problem are connecting with other people with lived experience of a mental health problem through a digital means, so through the internet or through other sorts of digital approaches. Online peer support can be formal or informal. Informal online peer support would be where people are joining online communities or on social media. You might find groups of other people who have a similar sorts of clinical background to you. They might have experience of depression, postnatal depression, or other sorts of things. Formal peer support is peer support that's provided by trained peer specialists. And so these are people with lived experience who undergo particular training to be a peer supporter, and they provide more formal peer support. Online peer support can be synchronous or asynchronous. So synchronous is where people are chatting to each other in real time in chat rooms, or it can be asynchronous, which is through bulletin boards and forums. Online peer support can help people feel less alone, less stigmatized, and it may be less confronting than seeking professional care. And in some ways it may actually encourage professional help seeking, particularly if people are saying, hey, you know, this particular approach worked for me, I tried this medication and it was helpful, or I tried this psychologist and it was helpful. So it might encourage professional help seeking as well. A bit of a word of caution, online peer support, particularly in informal settings, can be unmoderated. And so we need to be careful that peer support isn't actually spreading misinformation or transmitting misinformation to people. And so moderated settings are generally safer in terms of peer support as well. So what does the evidence say for the effectiveness of online peer support? There are very few controlled studies that have actually examined the effectiveness of peer support. Most studies have evaluated a digital program, like a digital online program, and they've added peer support as a component to that, and they've evaluated the effectiveness of it in that way, rather than as a standalone intervention. And there are lots of studies that have looked at how and why people use online peer support rather than how effective it is for symptom reduction. However, there is some evidence that it decreases depression and has associated with increased satisfaction among women in the perinatal period. There's some evidence to show that it's feasible, acceptable, and has preliminary effectiveness for people with serious mental illnesses such as psychosis, schizophrenia, particularly when it's combined with other digital tools like online programs. There have been some studies that have shown positive effects on clinical and personal recovery outcomes in young people. And among people who have subclinical symptoms or don't have a clinical diagnosis, informal peer support online does seem to have positive mental health benefits as well. So rapidly moving on now to digital screening tools. So digital screening tools are essentially if you go online and you complete a depression quiz, or you might want to know, how are my drinking levels compared to other people. There are different types of digital screening tools that are available, and they're essentially designed to help people recognise symptoms, whether they have symptoms of a particular mental health problem or what the severity of their symptoms. They can be used for tracking symptoms over time, so tracking fluctuations and change. And they can also be used to encourage formal help seeking as well. As I said, they usually exist in the form of online quizzes, but more recently there's another form of digital screening that's come out called ecological momentary assessment. And this is where people receive prompts on their mobile phone to complete brief quizzes about their mood or about some other symptoms they might be having. And they might receive a text message to fill in these very, very brief quizzes at different times of the day, different times of the week. And then you can track over time how your symptoms are fluctuating over the course of the week. And so it's a really, really useful way to capture real-time data about how you're feeling and how your feelings are changing throughout the week. Normative feedback is another application of digital screening tools, and this is used commonly in the substance use space. And normative feedback refers to where you apply a screening tool to somebody, a digital screening tool, and they fill in sort of their level of drinking behaviours or gambling behaviours or things like that. And then they receive feedback about where they sit relative to the population. So relative to other people of a similar age, of a similar background to them. So they can judge, well, where do I sit relative to other people? Is my drinking higher or lower? Is my gambling behaviour higher or lower? We just have to be careful with digital screening tools. Obviously, for some people, there might be a risk of self-diagnosis. They might go online and do a depression tool and go, oh no, now I have depression. We know diagnosis is complex and multifaceted, and they can't be achieved by a simple digital online screening tool. So we just need to be cautious around that. So what's the evidence for digital screening tools? In terms of ecological momentary assessment, so that's when you receive little prompts on your mobile phone to complete brief quizzes throughout the week. There is a lot of really good evidence now that it can identify markers that can predict future symptom fluctuation. So if clinically you're wanting to track somebody's symptoms over time, or you might be wanting to predict or flag times of the week when their mood might dip, for example, ecological momentary assessment can be really helpful to be able to gather and obtain that data. For some people as well, there's studies now that have shown that engaging in these brief assessments via your mobile phone can reduce symptoms of depression, anxiety, alcohol use, and non-suicidal self-injury, because it increases people's awareness of their symptoms and their self-efficacy to be able to do something about it. If you're aware that it's happening, you then feel more likely to make changes or to enact things that can be helpful for you. Screening and normative feedback. There's some evidence that providing screening and that feedback about where you sit relative to others can be helpful in the substance use space, but the evidence is pretty mixed for depression and anxiety. Several studies have found that it has no effect, and there are actually some studies that have found that it actually leads to reduced professional help seeking, because it can increase people's self-stigma, or how much stigma they feel about their own symptoms. And so just some caution around the use of these tools for not across the board. Therapeutic gaming. So this is another really interesting digital health space. And so therapeutic gaming was initially used in cognitive rehabilitation, but it's essentially where you can use video games or digital games, mainly simulation games or role-playing games where you can be different characters, you can explore empathy, personality. There are digital puzzle and strategy games to encourage critical thinking, problem solving. And simulation type games, similar to VR, can actually help people to develop real world skills as well. Therapeutic gaming has the potential to engage people who might find traditional therapeutic spaces challenging as well. And when we talk about therapeutic gaming, we can talk about commercial products. And so we can talk about the use of things like I've put an ABC kind of article up there about Fortnite, which is a commercial product, and the impacts of that on mental health. But when I'm talking about therapeutic gaming, I'm mainly talking about purpose-designed therapeutic serious games that have been developed by researchers and clinicians to teach specific skills. But it's just done under the guise or in the environment of a therapeutic game. So it's designed like a game. And Sparks is an example of this. Olivia spoke about Sparks last week, which is a program that's developed in New Zealand. And it's a role-playing game designed to teach CBT. So what's the evidence for therapeutic gaming? There's some evidence that serious games, particularly those that have a primary purpose other than pure entertainment, so we're not talking about games that are just about, fun, they can improve things like self-esteem, emotion regulation, problem solving, self-efficacy, and a range of different positive outcomes. There's some studies that have shown they can improve executive functioning and attention in people with neurodivergence. There's also RCTs that have demonstrated positive impact on depression, interestingly, but not anxiety in young people as well. And so that's sort of where the evidence is currently sitting for therapeutic gaming. Moving along to our digital treatment programs and virtual clinics. And so this is, when we're talking about digital treatment programs, or some people refer to them as virtual clinics, there are some really good examples of those in the Australian context. MindSpot is one of those. And essentially what a digital treatment program might be is it's taking a digital online modular program, so the very first types of digital programs I spoke to you about today, like Mood Gym and My Compass, and it's combining it with really intensive and guided clinician support. And that's why it's called a virtual clinic. It's a more comprehensive and more targeted and guided version. It's providing essentially a course of therapy digitally using these modular online programs and combining it with therapist support and increasing or decreasing the level of intensity depending on how somebody's symptoms are going. So it's a little bit more of an intensive way of delivering a suite or a course of digital treatment. As I said, MindSpot's probably Australia's most kind of commonly known digital treatment program or virtual clinic. And I've included just some research very specifically on the MindSpot digital treatment program. And there's been a lot of research that's been conducted on that, and it has been shown to be associated with significant symptom reduction, reliable clinical recovery, and there's generally high rates of satisfaction among people who engage with the MindSpot digital clinic as well. I'm going to skip telehealth, but I'm not going to talk about telehealth a little bit because I wanted to sort of focus on sort of digital tools and things like that you can use. So I'm going to skip that, and we're going to move straight over to wearable devices or monitoring tools. This is more of an emerging kind of technology, although it has been around for a number of years now. But it's essentially where we're using data from your smartphone or data from a smartwatch or some other sort of device that you're using in your day-to-day kind of life to gather data and information about various different symptoms that can be linked to your mood or your mental health. They're great for gathering data passively, unobtrusively, and in real time. So unlike ecological momentary assessment, where we're getting people to obviously fill in screening tools, your devices can be capturing this data in the background without you even knowing it. So you don't even have to be filling in little surveys or tools to be able to capture this kind of data. There's so many sensors in your smartphone, in your smartwatch, such as your cameras, microphones, GPS, accelerometers, gyroscopes, your Wi-Fi and Bluetooth connectivity. Really interesting data there around how close you are connecting into other people. If they've got Bluetooth on their devices enabled, it can actually be a proxy for social isolation, for example, if your phone isn't really connecting to other people's phones or to other sorts of digital markers as well. Light and sound sensors. All of these things can gather data about how active you are, your heart rate, your physical location, where you are, if you're staying in your room a lot or if you're not leaving the house, patterns of your smartphone use, how you're typing messages on your phone, how you're using the keypad. Keypad strokes can indicate mood as well. So this is how wearable kind of devices and monitoring tools can be used in a clinical kind of context. They can provide really useful information about the relationship between what's happening in your life at the time and your symptoms as well. But of course, two really important considerations are client acceptability. People have to be okay that this sort of stuff is happening in the background, and consent obviously is key, because quite understandably, a lot of people can feel quite unsure about the passive collection of data in the background as well. So what does the evidence say about the data collected for wearable monitoring and the clinical applications of that? There's research now to show that there are significant associations between depression and between the digital features that your smartphone or your smartwatch might be collecting, like sleep, physical activity, your location, and how you use your phone or how much you use your phone. For example, decreased mobility, reduced sleep duration, and lower conversation frequencies with other people have shown to strongly correlate with depressive episodes and clinical severity of symptoms as well. Many studies have focused on using sort of one of these different types of data sources or one sensor, but more research is needed to find out the optimal combination of all of these different data sources and the relationship of that and mood. Some of the studies in this field, though, because it is still emerging, are that they're small sample sizes, they're only short monitoring periods, so they haven't sort of looked at collecting this data over a longer period. And a lot of these studies have limited external validation as well. And so there's just some limitations currently in the evidence around this, but there's still pretty good evidence for the associations between depression symptoms in particular. Finally, the last tool I'm going to talk about the evidence for is we're going to talk about chatbots, AI, and digital companions. And again, you're going to have more content obviously on this kind of space, but we're going to talk a little bit about what they are and what people use them for, and what the evidence currently says about them as well. And so in their sort of most purest form, these are AI programs that are designed to simulate human conversation or a human kind of relationship or interaction. The really important distinction that you need to be aware of when we're talking about chatbots, AI, and digital companions, they're not created equal. So we're not talking about the same things. For example, somebody going online and using ChatGPT for mental health support, so using it as a proxy relationship, asking it for advice, getting it to give them information, is very different to using a purpose-designed, rule-based mental health chatbot. These two are very different things. ChatGPT wasn't designed for this purpose, whereas there are a number of digital chatbots that have a mental health focus and were designed specifically for that purpose, and they're rules-based. And what that means is that they have a predetermined set of responses that people can be provided with. So they're not kind of, it's far more controlled, the information that the AI or the chatbot is giving back to the person, as opposed to, say, from using ChatGPT. So these are sort of two very distinct things. Chatbots, digital companions, can provide information, advice, emotional validation. They can emulate empathy. If people are lonely, they can alleviate loneliness. They can be used as a substitute, for our human relationships. The word of warning, of course, is just that consumer-facing non-mental health products, so use of your ChatGPTs and things like that, they can be uncritical, so they don't challenge your own, challenge what you're putting into them. They can reinforce unhealthy patterns. They can establish unrealistic expectations about relationships. They're very one-sided, and they might actually delay professional care as well, which is why advisories have been released about the use of these sorts of things for mental health support. So what does the evidence currently say about chatbots, digital companions? There's really good RCT evidence that purpose-designed chatbots for mental health are associated with good effects, small to moderate effects for mental distress, and promoting health behaviours, particularly in young samples, so adolescents and young adults. As I said before, chatbots that provide responses from a predetermined list of clinical kind of responses demonstrate consistent and reliable effects on mental health, compared to generative systems that are a little more unknown or uncertain in the types of responses that they might give to a user. We're still understanding, however, how people are using consumer-facing applications for their mental health, such as ChatGPT. So high-quality evidence is currently lacking because we're really at the edge, of this at the moment, and that's why advisories have been released because of some of the reported adverse effects that people have been experiencing as well. So this is very much a watch this space. I realise I have just whipped through the whole sort of different gamut of different types of mental health tools and the evidence. But as I said, if I've gone through very fast all of that sort of content, all of the references that I've drawn that from will be provided at the end of the slides. And so you can go and do your own research specifically about any of those different types of approaches. But hopefully it's given you a good overview of what's out there. And so in the final part of the webinar, now we're going to pivot a little bit and we're going to talk about ways now that you know about what's out there in the digital space. How can you use it in your clinical practice and how do you judge the quality of these different types of tools? And so I'm going to talk first about methods for integrating digital tools into clinical practice. And I like this diagram because it's quite simple. And I think when you're thinking about integrating, or using digital tools in your clinical practice, it can be as simple or as complex as you want it to be or as you would like it to be. And so at their most simple, digital tools were designed to increase the accessibility of mental health care. So a lot of them are designed to be used autonomously, independently, and as a self-help tool. So they're designed to be used kind of in a way outside of clinical practice, really. And they're sort of things that people can go away and use by themselves. And so at the very simplest way, they can be just, referred to as, hey, I found this app, would you like to go and use it in your own time? That would be using it in a very sort of self-help way. Digital mental health tools can also be used as therapy extenders. And so in a way, they're not essentially integrated into the therapy that you are, the services that you're delivering in your day-to-day practice, but they might be used to extend the therapy that you're delivering. So for example, if you can only see your clients once a month or, reasonably infrequently, digital tools can be used to bridge the gap. They can be something that you could recommend to your clients and that they can use outside of sessions to reinforce some of the principles that you might be working on in your clinical therapy. Or they might be used for relapse prevention when you've finished a course of treatment with somebody and you could recommend a digital tool and say, hey, go away and continue to use this in your own time to remember what we've worked on and what we've talked about as well. And then in the most integrated form, I suppose, is where we're talking about virtual care platforms. And this is where digital health or digital tools are really integrated into the service delivery models of services. And so this is where you might be using telehealth, or you might be using a digital platform that combines telehealth and combines face-to-face sessions and combines digital approaches that you might be using in session with clients, where you might be actually filling in digital tools together, or you might be working through a digital product or a digital online program together, or it's providing your therapy through technology or using technological means. So these are kind of these three ways of thinking about it, I suppose. If you're looking for something a little bit more, I would encourage you to read this paper by Julia Reynolds. She actually wrote a paper on 5 models of using digital mental health tools in clinical practice, and she's extended this idea that I've just spoken to you about, and she's kind of provided a lot more detail. And so she says there are 5 ways essentially that you can use them in clinical practice, and they vary from least intensive to more intensive. So if you don't have the resources in your service to be able to integrate them really intensively, you might work in kind of a promotion model or a case management model in terms of your digital mental health practice, for example. So I won't spend too much time going into it because you can read the paper, but I've just put on the slides, for example, here. This is a lot of text and a lot of information, I apologise. But the first 3 models that she proposes are the least intensive ways that you can use digital mental health tools in your practice. And they vary from things like just recommending a tool to somebody, that would be promotion, to case management, whereas you might do some sort of assessment with your client to figure out what digital tool might be the most suitable for them. Then you would recommend that they go away and use it, and then you might check in with them and see how it's going. Coaching, you might provide a little bit more of an intensive support. So similar to when I was talking about guided online programs, a coaching model might be where you recommend or use a digital tool with your client and you have regular check-ins and intensive coaching around, so you know the tool pretty well and you work with your client around parts of it they enjoy, parts of it they need more support with. So these again, this table is really helpful because it can give you information about you know, what do I need to know? What sort of tool, you know, what role does the tool play? What sorts of workers is it likely to suit, and how much knowledge should I have? Finally, models 4 and 5 are really about more heavily integrating digital tools into your practice. So it might be about, you know, delivering face-to-face therapy, but using digital tools really consciously and purposely in each session, for example, right down to a really comprehensive, you know, integration of using digital technological approaches and face-to-face therapy and kind of mushing them together. In a really purposeful kind of way. So again, this information will all be on the slides, so you can delve into this a little bit more deeply if you're thinking about, okay, where do I sit in terms of my clinical practice, and what sorts of supports and resources might I need if I'm going to use any one of these particular models. I just wanted to do a slide really quickly. There was a study that was conducted back in 2020, so it's a little bit old now. It would be really interesting to conduct this study again now in the sort of the post-COVID times, but it was just really looking at what do mental health professionals actually think about digital tools and using them in their practice. And so it's important that we consider mental health clinicians and digital practice, because clinicians are important gatekeepers. You know, how they think and feel about the use of digital tools in their practice is going to impact how their clients think and feel about digital tools. And so if we want high uptake of these tools, or we want to be able to use them, we need to carefully understand, what do clinicians actually think, and what do they like about them, but also what difficulties or challenges or concerns do they have about digital tools as well. So clinicians are really important gatekeepers. The evidence from this study said that clinicians seem to support the use of digital programs or digital tools, particularly for clients who are low risk, for clients who have strong motivation and engagement, for clients who have higher computer literacy and access, and also have a low need, you know, for tailored content as well. They like the flexibility with timing and location of online programs. They have a strong preference generally for blended therapy, so clinicians seem to like the idea of not, you know, giving up all of those traditional therapeutic components, because they facilitate rapport and enable active monitoring and follow-up, but they like being able to blend, you know, digital approaches with you know, their sort of standard clinical practice as well. They identified a need for really targeted training and support around the use of these tools. And of course, there are always ongoing concerns about confidentiality and security of client data as well, particularly when using digital mental health tools as well. And so a really important point here is that Olivia spoke last week about digital equity, and we need to think as clinicians that if we believe that digital tools are really the safest for our kind of people with high you know, computer and technological literacy, then there's a whole range of people who also may be potentially missing out on the use of digital tools, who may just need a bit of extra support. So we need to think about, how do we actually work on things like digital literacy to help you know, other people who may benefit from these sorts of tools be able to access them. Okay, so we've looked at all the different types of tools. What's the evidence for them? What are the different models that you can use to integrate them into clinical practice? What do professionals think? How do I find them? Where should I look? Where should I go if I'm wanting to find digital tools and be able to identify which ones are out there in the community and available? The place you should start is MPRAC. So if you are not aware of MPRAC, MPRAC is a government-funded research service, and I think it's run by QUT, but its whole purpose is to help clinicians, particularly mental health clinicians, be able to navigate the digital space and to understand what tools are evidence-based and what tools are available. So on the MPRAC website, there's a really great digital mental health resource directory. So you can go there, and if you're looking for something for depression or for anxiety or for reducing hazardous alcohol use or any of those sorts of things, improving sleep, you can check out their digital mental health resource directory, and they will have trustworthy programs on there that you can go and browse and be able to recommend to your clients as well. The MPRAC website also has a range of other really helpful tools about how to refer your clients to using digital tools. Professional development, they've got a great podcast series as well if you're interested in the digital space and you want to listen to other practitioners and how they use digital tools in their practice. So the MPRAC website is a fantastic resource for working in the digital mental health space. I've included another portal up here. This was developed by a research colleague of mine, and it's called Mind Tools, and it's essentially a portal where you can go and you can find a range of different online digital tools that are available for mental health, and it rates them according to their usability. So they're sort of like their client usability and how whether they have good features that will help clients be able to engage with them well. And so it's a nice website to be able to explore, to be able to figure out what's out there, and also how usable it is as well. So that's just another portal that you can access and use. Finally, the last sort of couple of slides that I wanted to talk to you about was I wanted to just give you some tips and tricks and some pointers about, well, you know, I know how to look for the evidence now. I know that I can understand what the evidence says about these programs. I know that I can go to a portal like MPRAC or like Mind Tools and be able to find programs as well. But what sorts of, and I'm using this from my own research and clinical experience, when I'm judging the quality of a digital tool, what sorts of things do I look for, and how do I judge the quality? So this is my sort of personal checklist that I'd like to share with you as well. First of all, who made it? That's probably the biggest, and most important thing, or one of the most important things that I consider. I generally find tools that have been made by research institutions, universities, clinical groups within universities to be the most trustworthy tools. That's not to say that entrepreneurs, commercial companies aren't producing high quality products, but generally I will trust it a little bit more if it's developed by a university, a research body, a health service, or a government body as well. So again, really understand who made it. You know, is this just an app that some person has just put out onto the App Store and you don't know who they are and where they've made it from? So that's probably the first thing that I would look for. The second thing I would look for is it evaluated? Does it have any research evidence? And a good quality digital tool on its website will have information about research. It will have information about whether it has been evaluated. So you also want to consider, how has it been evaluated? Has it been evaluated in a randomized controlled trial, for example? Or do they just have testimonials on their website about people saying, I liked this program or this app worked for me? So apply your critical, kind of scientific brain to this and think, okay, well, what's the research? How robust is, and scientifically robust is the research that has, evaluated this? And a lot of really good quality apps and digital programs that have been developed by commercial companies, for example, will partner with research institutions to conduct research as well and to evaluate their programs. So just look out for those sorts of things as well. Do they provide information about privacy and security of personal information? All of these digital tools collect, store, and use personal information. So when you're engaging with them, they will be collecting the information from your client or from you if you're a user. So you want to know that they're going to be providing you with transparent and clear information about how they keep your information secure and also what they do with it. How do they use it as well? So that's really important information. If an app or a program isn't really clear on this, that's something that is a little bit less trustworthy in my mind. Does it cost money? Whether it costs money or not isn't necessarily an indicator of how high quality it is. This is just a consideration when I'm thinking about it for my clients. Obviously, if it has no cost, that's something that cost can be a barrier for some people. So I sort of think about that as well. Just because something is free doesn't necessarily mean it's high quality. Just because something costs money doesn't necessarily mean that it is high quality. So I just have that in there as a consideration, but just something to think about, particularly when you're recommending it to clients. Another thing to consider, particularly in the Australian context, is has it been accredited according to the National Safety and Quality Digital Mental Health Standards? These standards were released several years ago, so they're relatively new, but they've been around for a number of years now. And there are a number of digital tools and products that have to undergo accreditation according to these standards, and they essentially have to meet a particular threshold or standards around clinical and technical governance, how well they've partnered with consumers and people with lived experience in their development and their ongoing delivery of the tool, and also the model of care that's provided with the digital tool as well. And so look out for this accreditation. There are several really good Australian tools now that have been accredited according to these standards. And so it's just, again, another marker of trustworthiness that you can consider as well. The final thing is try it yourself. You're a great judge. And so when I'm recommending a digital tool or an app to a client, I download it, I register for it, I have a play with it myself, and I see, is it useful to me? Do I like it? And based on my own research and clinical expertise, does it seem to be based on sound, clinical, evidence-based principles? That's something else that I look for as well with these sorts of things. And my final slide, as we're sort of reaching the end of our time together this morning, is I've included the paper in the references at the end of this, but this is also just another kind of checklist that you could use when you're thinking about selecting and recommending a particular digital tool to a particular client. You can kind of think about and apply these different sorts of criteria. So, trust, we talked about all of the different things that you can consider when you're considering the trustworthiness of a particular digital tool. Do you have trust in all of that stuff I talked about with privacy, security? Do you have trust in the company or the organization that made the tool, that is administering the tool? Evidence, as we talked about, is it evaluated? Has it been evaluated in the population that your particular client belongs to? So, for example, if the research has only been conducted in people with a certain socio-demographic background or profile or cultural background, does that match your client? And so how well can you match the evidence that's been generated from that particular evaluation to the usefulness for how useful it might be for your client? If it's not evaluated, is it based on evidence? Is it evidence informed, or is it based on evidence-based solid clinical principles? Is there ongoing oversight of this tool? Is it updated regularly? Is it continuously evaluated? Think about usability as well. Is it intuitive to use? Is it inclusive? Is it adaptable to diverse populations? Could it be used by someone with lower levels of digital literacy or reading ability or things like that? How much text does it use? Does it have fancy technological features that might be not consistent with the experience or resources that your client has? Does your client have the technology to be able to engage with this tool as well? A digital tool must serve and prioritise the interests of your client. So it must be able to be used autonomously by your client. Your client obviously has the ability to accept or reject use of that tool. So is lived experience taken into account? Is this actually going to serve the needs and the interests of your client? Obviously, ethical and legal considerations are incredibly important. You're also going to have a wonderful webinar about these sorts of considerations as well. And finally, accreditation, as I talked about. In the Australian context, we have these digital mental health standards, but thinking about tools that have been developed in other parts of the world, do they adhere to some sort of agreed, set of principles or standards as well? And so that brings me to the end of my really rapid fire evaluating digital tools webinar. I am contactable, so please, now that we've had this time together, my details are on the slides, and so you can reach out to me at any time if you have any questions about anything I've spoken about today. And you'll be provided with the slides from this webinar too, but I also just wanted to show you that I've just got lots of references at the back here of these slides so that you'll be able to find any information that I've spoken about super quickly. So thank you very much for having me.
Hello, that was so fascinating, and I learned so much more in terms of thinking about how we use these tools. We have got a question that's been popped into Q&A, and if any of the other listeners have a question, we've got a few more minutes. Mark has said, this is very useful. You mentioned that chatbots are uncritical, may reinforce problematic behaviours and have unrealistic relationship expectations. Can you please help me understand what leads to them being this way? Are they designed to tell the user what they think they want to hear?
Yes, thank you. That's a really, really great question. And that's the distinction, I suppose, between sort of generative AI tools such as ChatGPT that weren't designed or set up to be therapeutic in that kind of mental health sense. And so, yes, what user experience has shown is that there are some well-documented examples now where generative AI chatbots are not necessarily, they're sort of designed to be, how would I put it, a little bit people-pleasing, I suppose, to sort of give you, because they're designed to sort of continue to engage you, right? Or to give you the answer that you're seeking. They're designed to be helpful, I suppose. And so if you're putting into these generative AI tools, looking for particular kind of validation or support, it's going to give you essentially what you want to hear. And so that's kind of what we mean by uncritical. And so, you know, there's probably many, you know, types of examples of this, but obviously in depending on the nature of kind of, you know, other sort of human relationships that you have, people might disagree with you or they might offer different perspectives. Without being an expert in AI, you know, generative chatbots are not necessarily designed specifically to be that critical counter argument to you. And so there is a risk there that they might sort of continue to tell you that you're right and that what you think and feel is valid. And in some cases it is, but it might not actually engage in that kind of, you know, gentle challenging that a critical thinking human, you know, might engage you in as well. And so, and when I talk about sort of unrealistic human relationships as well, I suppose is that it's very one-sided, you know. So obviously human relationships are dynamic and two-sided, and they take into account the needs and wants and feelings and perspectives of two, you know, independent bodies. Because the agent isn't that kind of independent body that has needs or wants or feelings, it's essentially there to serve you. And so that's sort of the key difference, I suppose, between that being or the danger, I suppose, of it, people considering it to replicate a real human relationship, you know, which it isn't. So, very long. I'm not sure if that answers your question specifically, but that's sort of, yeah, where that they're sort of, they're not designed, you know, they're sort of set up to give you what you want, essentially.
Yeah, and it sounds like there's a number of factors that go into it. I've got a question for you, and it looks like there's another one in there. I'll just get Laura to pop the evaluation into the chat as well while we're chatting, because it's very important for those listening. It's very important to uh, fill out the evaluation. Let us know what works so we can do more of it. Let us know what you would like more and different of. So please complete the evaluations to help us demonstrate what we need to deliver more of. Um, Jonathan says, I had some good experience myself with voice messages with affirmations and suggestions from a person acting as a therapist support. Do you know anything about that practice? So, Jonathan, was it actually a person or was it like an order? I'm imagining that was like an automated thing. Good experience with voice messages with affirmations and suggestions for therapy support. Do you know anything about this practice? Oh, no, it was a person, says Jonathan.
Oh, okay. Yes, it was a person. Yeah, yeah, absolutely. I mean, if it was a person who was providing that kind of affirmation or that kind of helpful suggestions just through a digital kind of means, absolutely, because that's just, I guess, what you would get in a normal kind of human interaction. It's just providing it, you know, through some sort of digital means. And so, yeah, if you're receiving it through that way, then it still, I guess, has the same kind of clinical and therapeutic benefit. Something I just wanted to point out as well is that even though that's from, the use of the actual voice was helpful. Yes, yeah, interesting. Okay. I'm not familiar again with the distinctions between whether actually having, you know, whether having a human voice provide that, you know, through a voice message or a voicemail or something like that is actually kind of more clinically beneficial or therapeutically beneficial than, say, having it in text or even having it as an AI voice. You know, you hear those kind of like generated voices as well. But that would be I'm not sure of the research, you know, sort of around the differences between that. So that's very interesting as well. But the AI chatbots that I was talking about in the chatbot section that use sort of rules-based responses, is that those actually work. They have a lot of kind of therapeutic benefit because they essentially, in the chatbot back end, they've got a whole range of, I guess, kind of, you know, clinically appropriate and validated responses, right? And so when you're engaging with these particular chatbots, you know, you can type in something and it's going to give you a response from a predetermined set of responses that we know are validating, clinically helpful, you know, all of these sorts of things. And so those, when people are engaging with those sorts of chatbots, there's pretty good evidence to show that they're effective as well. So yes, I guess it's just, again, around that kind of that clinical kind of validation and whether the chatbots or the technological agents are actually saying things back that mirror what a psychologist or a clinician or a mental health professional or a doctor or somebody, you know, would provide back as well. So, yeah.
No, I had a final question for you. Oh, and it's right on 11. Last week, Olivia and Belinda talked about the grid of you would have seen it, optimist, realist,
Mm.
negative, pessimist in relation to future of digital tools in mental health. Where would you put yourself?
Ooh. I look, I mean, I have to say, I come from the bias in the sense that, like, I've worked in this space for 25 years. And so it thrills me. I love it. But I think you have to be, I'm also a scientist, so I follow the evidence. And so I think these tools, there's an inevitability in my mind about how they're used in healthcare and in clinical practice. And I think they have a lot of benefits. I'm about utilising their benefits to the full potential that the evidence says that they're useful for, but I'm also not a I don't think they are replacements. I don't think that I think we need to be, I'm very, very eyes wide open, even though I'm an adopter and I have drunk the Kool-Aid, I love them. But I have to think I'm really, really clear about what they're not good for, what the limitations are, and what they can't do. And so I have an open mind, I suppose, about where we could go in the future. I have no idea where technology will take us, but I suppose I would say I'm, an optimist, realist. I can't specifically remember the different ones, but I would say I really am fascinated by this space and I think it's enormously useful, but I have a critical lens, I suppose.
Yeah, great. That sounds like a really good position um, to put to move myself to because I get very excited by it and tend to be an uncritical adopter. So I like that. I If you've got time before we go, just fill out the poll to help us learn a bit more about what you would like more about. Um, and I will be sending out the slides and the recording so that you can watch it again and learn more. And yes, come and join us. Next week, we have Shaminka and Shona from Origin with some panel members who are the people who helped them design, and they're talking about designing digital tools and co-designing digital tools with people with lived experience. So they'll be coming along and talking about their experience of that, and that's next Wednesday. So thank you very much for joining us. Thank you very much to Dr. Lou Farrer. Another round of applause if we can, and yeah, we'll look forward to seeing you at future ones.
Thank
Okay,
you all.
thanks everyone.